like I said, I work on the weekends, every weekend, and I see cases. We have air rooms, which is airborne protected rooms that actually we put these patients in.
This corona is brand new. Like, nobody really knows what we're dealing with. So I think that we not only owe it to ourselves, but to our patients to allow the time to pass for us to accurately research this and really realize what we're dealing with.
They're actually trying to make it mandatory in Washington State, where it's part of written in the law, where you have to use it if you're using an ultrasonic. You're no longer allowed to use the low vacuum, which would in turn help to eliminate some of the aerosols that are, filling the air. Okay. So there might be some easy things we can do to limit the amount of exposure we have, like using a high vac.
I am Martel Koch, the founder of Muniz RDH. We're a nonprofit organization that gives scholarships to dental hygiene students in any minority in dental hygiene, including males. So today we are having an open discussion about COVID-19 and how it has affected the male health practitioner, whether they be registered nurse, dentist, RDH, or health fitness coach. So we're going to start off with introductions. We're going to start off with Derik. So welcome.
Which one of us?
Oh, we have two Derek. So Derrick J. I'm sorry, Derrick J.
Okay. My name is Derik. I'm a hygienist. I live in the Seattle area in Washington State. I've been practicing for about 5 years now. In addition to being a dental hygienist, I also have a bachelor's in administration, and actually that's primarily what I've been doing for the past 3 years. Less clinical and more on the admin side.
Oh, nice. So this is a perfect break for you because you can still work essentially, right?
Yeah, I'm switching offices right now, so we have a little bit of a glitch in Washington State. We can't work at all until May 18th. So not doing anything at the moment.
Wow. Okay. The second Derrick Black.
Hey, how y'all doing? Derrick Black, like you said. I'm a recent grad, actually. I'm here in Maryland, DC, DMV area.
Okay. When did you graduate?
So we finished our classes right at around March 21st. They made sure that we no longer can go in class. Our graduation date was supposed to be on the 27th. Wow. So they just sped us up. Some individuals didn't get to finish actually their requirements, but I guess they'll have to go back in, and that's a concern. Exams and stuff. We'll get into that later.
Oh yes, absolutely. Okay, Dr. Harris.
All right, my name is Devin Harris. I'm a general dentist in Austin, Texas. That's also my hometown, so good to be back home. I've been practicing coming up on 2 years here in May, and right now I'm working as an associate dentist.
Nice. Absolutely. MJ?
Hi, I'm MJ. I graduated in December of 2019, right before COVID took over the world. And I haven't had to practice. I haven't had time to practice that long. So yeah, I'm ready to share my 3 months of experience with you guys.
Okay, absolutely. Joesph?
Yeah, how y'all doing? My name is Joesph Heath. I work at Cape Valley in Fayetteville, North Carolina. I've been a registered nurse for a few years. I actually been a nurse for over 14 years. I appreciate y'all putting me on this forum just to hear your ideas or your aspect of which I think that where the COVID virus is going and where it's leading us to.
Okay, JV, Givi, can you hear me?
Yeah, I can.
Oh, okay, go ahead, dear.
Yeah, okay. Hey, what's going on, y'all? Givi here. I've been a hygienist for about 3 years now. Yeah, enjoy every bit of it. Do other things on the side as well. So I'm excited to kind of share my experience with, this virus and, possibly how dentistry will be changing from now on because it's a lot going on right now.
Where are you from?
Oh, I'm in Fort Worth, Texas.
Okay.
Where all of you guys should be. Nah, I'm kidding.
No.
Pretty funny.
Somebody from Texas would say that, right?
Okay.
I love Austin, by the way. I love Austin. Great place.
All right. Last but not least.
My name is Beto. I am in Dallas, Texas. I have been a
There you go.
hygienist for about 2 years. Prior to that, I was in the dental field, did many roles from office manager to director of operations, and I did that for about 10 years. So I've been in dentistry quite a bit, have seen many sides of it, and I've been through the H1N1 outbreak when that occurred, but this is nothing like it at all. For the H1N1, I don't remember completely shutting down and stopping dentistry.
Oh, wow. Yeah, so like, just to get started, like all of us have definitely been impacted with COVID-19. And this group that we have here is so diverse. And I feel like from administration to director of operations, entrepreneurs, dentists in here, like you guys can definitely start off by sharing how has COVID-19 affected you and what do you see post-COVID-19? Like where do you see your profession, you as your profession? Do you plan on changing professions? Like I've talked to a lot of males that say like they're trying to get out of dental hygiene. We're like high risk right now. We're high risk for everything, but we're high risk right now for COVID. And they're thinking about doing other things like nursing or, possibly starting their own business. So how has it affected you? Does anyone want to share that personally?
I guess I'll start because I know it's a convert. I'm actually one of the people that were pushing for dental office to close right after I started doing a little bit of research on COVID-19, because I just realized that there is no way we're doing the right thing by still seeing patients, because I understand that if there is anything that has to do with a virus that is spread to, aerosol and to droplet or anything like that, we only gonna make it worse. So although I was working up until I think the last week of March, I was always pushing like, I think it's the right thing if we kind of just shut everything down. So it's been a nice break, honestly. I needed to just kind of like shut it down for a week or two. I haven't had a vacation in like 2 years. So that part of it was cool. But honestly, the conversation on, whether I still want to be a hygienist after 3 years, I've been having that conversation for the better part of like the last 6 months myself, just kind of like looking at everything I've been able to do so far and what I think I can still be doing as a hygienist or just moving forward in my career. So it's one of these things that I have other things that I enjoy doing, and I could totally see myself walking away from, hygiene and be in business or production for a long time, and I would be fine. But I'll be honest with you guys, like every time I walk into my op or every time I walk into a dental office and I see a patient, it still feel pretty much like home to me. So that feeling hasn't gone away. So I guess I'll still probably be looking at, other options and pretty much setting myself up for what comes after this journey. But I don't know exactly when this is gonna stop for me, because the joy and the investment of still seeing patients, that's the reason why I went into hygiene in the first place. And that's when I lose that, that's when I'll start practicing, because I know too many nurses, like all my siblings pretty much are nurses and most of my friends, and it's not for me. Hygiene is where it's at for me. It's just that as long as I have the passion, I'll keep doing it. And whenever that goes away, I guess I'll stop. And it's just a matter for us now to just now being mindful of how exposed we are. We probably have some changes we need to, make happen as far as, protecting ourselves and our family and all people that come in contact with us.
One question that I had as I wanted to speak with it, the change in treatment plan. I know as we were students, they were telling us, okay, of course, you don't want to no longer use a Cavitron or a piezo because they cause those aerosols. We were going strictly hand instruments. Was that the same case for you all when it comes to the dentistry aspect? And again, for you, doctor, was that the same case? And how were you treating patients if they had cavities or whatever it may be, crown fixes and different things like that?
So from my aspect, it was kind of like a slow burn in a sense. Whenever this started really kicking off, when all the shutdowns started happening, just conveniently, my owner doc, he was on vacation for that week, and he had planned that like months ago. So I was the only doc in the office, and being 2 years out of school, it's you're kind of like, all right, make sure you do everything right. But as far as like the treatment plan changes and everything like that, I was just kind of following live like what the ADA was saying, what the Texas Dental Association was saying, the dental board. I was reaching out to colleagues, kind of seeing, hey, what are you guys doing? And, we cut off hygiene. At first we started like how everybody did, where you just kind of, cut out the Cavitron and piezo and just doing hand scale. But then we eventually just cut out hygiene altogether. And then became the question, all right, what is essential dental treatment? And that's where there was a lot of gray area coming in, because they were saying like at first, like, try to keep it to just emergencies. And then everybody's like, well, then what is an emergency? And so there's a lot of back and forth from both sides, from the people in the field and from the administration. And it finally got to a point where they said, if it's something that's going to put them in the ER, then take care of it. But then you got to think of it, all right, if I don't do this big filling in a couple of weeks or a couple of months, could this turn into a root canal? Could this turn into an infection? Could this tooth break? All these kind of things are going through your mind. So and then while this is going on, the team, the staff, you can kind of see everybody starting to kind of get nervous. None of us have ever really dealt with anything like this before. So everybody's kind of freaking out on the inside. And so for me, it was a little bit of a challenge to try to, keep my cool and also, be a leader and keep everybody safe. And, as everything started shutting down more and more, when we got to the morning huddles, like I told everybody, like, look, if any of y'all don't feel comfortable working, I completely understand. Don't feel like you're going to get penalized, but, I prioritize you guys' safety first. And really my thing was like, for me personally, like I wasn't really concerned about me getting it per se, but me getting it and then passing it on to some of my loved ones or, so on and so forth. So that was the main thing for me. But we just kept trickling down more and more like what we could do treatment wise until now we're at a state where we're only able to treat, emergencies only. We also put into plan different things during that time while I was there at the office. Like, whenever a patient would come in, we'd screen their temperature, have them fill out a questionnaire asking if they've been traveling recently, if they've had recent fever, cough, any of the other symptoms, things like that. We made the patient's temperature actually a part of the patient record. Mm-hmm. And also the agreement where we explained the risk associated with getting dental treatment done during all the COVID outbreak. So that way the patient was informed, that way, everybody's safe. And if it got to a point where they're like, I don't want to do this, then, then you can leave it at that. But that's what we were doing before we got mandated to completely shut down except for emergencies only. And where it stands now, we actually split the teams. And so right now the owner doc and half of the team are seeing the emergencies, 2 days a week. And I'm actually furloughed at the moment, so I'm not working. So I'm just kind of sitting here waiting until we're able to continue practice. And right now in the state of Texas, they're saying April, I think the 23rd is like the first day that we can start back. So, and I believe the board is meeting tomorrow to decide, if we're going to stick with that or not. So I've just been kind of playing the waiting game for right now. So that's kind of what's going on in my end. Sorry if I rambled a little bit there, but.
So interesting how different states have different measures they put into place. Washington State, to March 18th, our governor mandated dentistry to be emergencies only, and he was actually really specific on who could and could not be seen. He was like, anyone who in your professional opinion, who would be worse off if they had to wait 3 months, is the only people you could see. Other than that, you couldn't see anybody. And right now we have a mandate in place where nobody can be seen until May 18th.
Wow. Same thing here, Derek, in Massachusetts. When I got here May 6th, I had just applied for my license, and unfortunately, I couldn't even get my license here because they shut everything down May 12th or May 13th. So yeah, we are on a standstill currently. I mean, not May, March 13th, and we're currently on the standstill until May 18th. So we're just completely shut down until then. So Like you said, and if the patient can wait 3 months or 3 to 6 months, then they can't be seen. But if it's an emergency procedure where they have to be seen, like, oh, they're having pain or an abscess, then of course they can be seen, but nobody's in the offices right now. Nobody.
Yeah, I actually noticed that in the beginning with COVID, when they were like, well, some emergency patients could be treating, some offices were saying, well, since, we don't know when you're going to be back, let's just do everything. So they were doing root canals, go ahead and get your cleaning while you're here. Meanwhile, you're putting that patient and the team at more risk because you're producing more aerosols, the patient's in the chair longer. In my opinion, their immune system is being exposed to more. And that's what you saw a lot of dentists doing. So now people are freaking out because, let's be honest, this is their bread and butter. If you are independent practice and that's all you rely on, and maybe you let go your staff, but you're seeing emergencies, you're going to be like, yeah, I can do this filling and bill out. You need a sealant on this tooth. So that's where those ethical dilemmas are going to start coming in. Are you truly treating that patient just for that emergency, or are you trying to make up for what you've been losing? And is it an ethical dilemma, or is it just like, I'm here, we're just providing you the service because you're here and we don't know when the next time you're going to be? Another thing is they're making all these changes, like we're taking temperatures and doing a questionnaire. But what if that patient is asymptomatic and then you see that patient and then come to find out it's exposed? Is that patient going to say, I got it from this dentist's office because they did the cleaning on me? Or is there going to be a waiver? So I feel like post-COVID, patients are going to have to start signing something, a consent form, just like when you get your extractions done, to say, you know what, if there's a chance that you are exposed to COVID, it's to no fault of our own, or whatever the treatment plan may say. So we might see that being changed. And my fear is that the aerosol producing professions are gonna kind of like dwindle away. There's gonna be a shortage. So for like dental hygienists who are highly exposed and high risk, maybe there's gonna be slim positions for it, because the doctors are gonna be like, you know what, we don't need this hygienist. Patients are not coming in because they're scared, because we're not going to go back to what we were, right? Mm-hmm. And then it's the possibility that the profession can be not eliminated, but it's definitely going to be something that there's going to be a shortage of offices open. Maybe some dental offices might not survive COVID-19. And then the hygienist like me that's been in my office for 7 years, I don't have anywhere to go back to. So now I have to start looking for somewhere else. And then you have Derek, a new graduate, that's going to be competing for that same position because they're a new graduate. But maybe me, I'm a hygienist and I'm a prima donna, and I'm like, listen, you got to pay me $38. I'm not cleaning my room. I don't take x-rays. Whereas he just got out of school and he's like, listen, I know all of the latest and greatest about the OSHA recommendations, and that's what dentists are going to be needing. They're going to need those RDH that are up on top of their game, that have something to offer. I don't know what the standard is. I didn't just graduate, but someone like Derek who just graduated, he knows the right way to clean a room. I'm not saying I don't know the right way, but you do things in school, you put plastic and barriers on everything, and then you become practicing and you're like, well, we don't really have to barrier the keyboard if we're not touching it, or we don't have to do this. So things become real lax. So the dentist is probably going to be like, well, I want a new student because I know they're going to do everything by the book, and it might be a little bit slower, but I know they're going to get it done. So Malcolm, you too, like you haven't even started practicing in Massachusetts yet, but look how many cases are in Massachusetts. I think it's an overwhelming number of confirmed cases of COVID. So definitely for sure, I don't think hygiene is going to be something you're jumping into right away. Joesph, you're on the front lines in your RN. Like, what are you seeing? It's not going away.
No, it's not going away. Actually, believe it or not, it's going to be treated like the flu. It's going to probably come back every year. That's the sorry thing about it. Because of the fact that it's here to stay, it's going to be here to stay. Like I said, I work on the weekends, every weekend, and I see cases. We have air rooms, which is airborne protected rooms that actually we put these patients in because we don't want to be exposed. And we actually have a one-on-one care with this patient because of the fact that we don't want to spread it. We actually do a lot of different things and a lot of different procedures because we don't want to be exposed and we don't want to expose no one else. One bad thing about the medical profession is the shortage of. Yes, we have a abundance of masks, gloves, and stuff like that for the patient, for us, but we're looking at 6 months from now. Government saying what they're saying. I would love to say that we'll have respirators, we'll have ventilators, we'll have everything that we'll need. I don't know. I don't see it. But
what is a respirator? Because I've been hearing that. Is it something? What can you explain that? I really don't know.
Okay. I don't know what the forum knows about COVID-19, but it's actually a respiratory. It makes your respiratory system collapse. Just saying it generally, I give analogy of it just to give you a better understanding. Most people think of, when you think of your lungs, you think of broccoli, in which, you know how you look at broccoli, it's a little bush, like little trees. That is your alveoli, which what actually happens is that when the COVID-19 affects your body, it makes your body become inflamed. Your lungs become inflamed. So normally when your lungs will expand and collapse, they actually do a gas exchange where oxygen comes in, get connected with your blood, and carbon dioxide is exchanged out your body. With the inflammation, what actually happens is that your body stays swollen, inflamed, which causes the gas exchange to minimize, which now you need a device that actually helps you to breathe. And what it does is it takes the area where it actually has some gas exchange and amplifies it. Okay, it actually helps you breathe. We put like a mask that covers your whole face that actually allows you and makes you breathe in and out for the duration of days. It may take a day, it may take 14 days. I read today that we had a guy that actually was at Cape Valley for a whole 30 days because of it. And like I said, it's the worst feeling you ever had. If you ever had the flu, pneumonia, there's 10 times it.
Yeah,
So,
they were saying that was very similar. I don't know, want to get off topic, but it was very similar to what we were seeing when individuals were vaping, when the vitamin C acetate and how it was taking over the alveoli and solidifying in those. So the individual can't have that gas exchange. They can't open up and close. That's right.
Yeah.
So there's a shortage of respirators. So it's like, if you're older and you're probably not going to make it past this week, they're not going to give you a respirator, or like, how does that work?
You got to have, actually at my hospital, you have to have respiratory difficulties to actually get it.
Oh, okay.
And what people don't realize, these numbers that you're reading, you're hearing about, you're looking at every morning, you see they have special channels for, those numbers has been rated, I would say, because they're not counting, give you an example, they're not counting long-term nursing home facilities, long-term facilities at all. So everybody that dies at a nursing home is not counted. The health department is not counting those because they already have difficulties, and that's across the board, United States.
Yeah, I was hearing that as well. That's crazy.
So when you see a number of 905 today cases, none of that was nursing homes.
So you're saying it's a lot worse than what we think it is right now?
It is.
Wow.
And because we're not getting tested properly, the numbers are probably skyrocket. I mean, like I said, I don't know how your profession totally is, but I know that they're offering a lot of money and incentive to go to these hot spots: New York, California, Washington,
That I
Chicago.
can agree with. My boyfriend is a contractor. He works in a lab, and we just got a contract for New York, and they're paying $4,000 a week just to go to New York.
Well, let me show you the nursing aspect. I live in Fayetteville, North Carolina. I'm from New York. They offer me $13,000 a week. $13,000 a week for 21 days. And I have, like I said, I have property there, so I can actually do that. I'm not.
But that's hazardous pay. They're paying you that way.
Well, no, they give it. Yeah, it's hazardous pay. We call it crisis pay. Same thing. Actually, the government's actually trying to put in place another overlay of that money, which they're talking about another 20. If you don't make over 130,000, I'm sorry to take you off the spin of this, but if you're not making over 130, they're going to give you additional 25,000. $20,000 or $12 an hour, whichever
My
one
thing
we
though,
determine.
is it my question though, when I see the news and when I hear from other nurses, like, is it worth it? Because you see so many horror stories of nurses not being protected. And that's my fear as a hygienist, like going back to work and not truly being protected from COVID-19, like seeing patients and not being, sure if this patient is asymptomatic or if I'm fully protected from taking this virus back home to my family. And so, yeah, the government may be considering opening up soon, but my fear is like, okay, if I, as a hygienist, am I going to be protected going back to work? Because I don't think for like a month or two, I would want to go back to work, and that may be just me, but I'm just a little skeptical about things.
Well, I would hope that every time you go into a situation that you always take that situation as the worst, meaning that, like, as me going to work, I actually think of every patient of having TB, which is tuberculosis, having AIDS, having the worst disease possible. So when I go in that room, I'm going in that room with the same sight. I tell you just like this, I go there hoping that my job has respirators, but in my bag I have 10 of them sitting waiting, because if they can't meet my demand, I'm actually going to get it elsewhere. We have to prepare and protect my family and myself. Okay, now of course, unfortunately, not everybody can do this because of the fact that this epidemic actually came abruptly, and a lot of people wasn't prepared. That's just like toilet paper. People wasn't prepared, and they may not have made provisions for this. So, but like I said, I just feel that everybody need to protect themselves on a one-on-one basis, social distance and stuff like that. Like I said, I apologize for taking you off your form.
You're fine.
Yes.
I think medical and dental is going to be integrated that way, to where we're going to have to start learning how to take temperatures and screen patients. And I think we're going to be doing more of the medical realm of things, because these patients you don't know if they're asymptomatic. So we're going to have to take the precautions that nurses take, which we should already be doing, but we all know that the dental field is very relaxed. Like, someone comes in and they have a cough and they're like, oh, it's allergies, and we're treating them. They got a little herpes crusted. You like, oh, it's crusted over, we good. In reality, like, and don't touch it. Like, it don't matter if it's crusted over, but it's more relaxed. So there's this big thing about, is dentistry essential? Are we doctors, or we're dentists? We're not doctors. So now that whole controversy is back. Dr. Harris is like, we're doctors. Doctors of dentistry.
I can just see my fist right now. No.
But yeah, once they start integrating that, like, their medical and dental is going to have to be merged, and we're going to have to start taking things just as we might have what is it called, pulse oximeter, those little things that go in your finger. We might do that as well.
For me, it poses a good question. Where do dental hygienists lie on the outside of this thing? Like, how do we come out on the outside of this thing? Because, for me, things are gonna open up slowly, and as I only have like 2 to 3 months of experience, and so for somebody like Derik, who is a new grad, it's just like Martell said, Martell has all of this experience, but we're new grads and we may be up to date on things. However, she's quicker, she's faster, she doesn't need as many instructions, or she doesn't need as much guidance. So how do we as hygienists, how do we balance ourselves, or how do we, not even balance ourselves, but how do we come out on the other side of this thing? Because it's so many questions, it's so many unpredictables. For me, like I said, I'm new to this industry, I'm new to this field. I don't know how this plays out for me. And so it's just like a lot of what ifs, And so Martell said it earlier today, do we branch off into other fields? Do we go in other directions? Because like I said, for me, it's just like, okay, it's questionable, because my whole life, this is my passion. I love dentistry. I love cleaning teeth. I love being a hygienist. But at the end of the day, on the other side of this thing, when COVID-19 is like not a big fear, what am I going to do to,
A lot of people are going to be
feed my family,
a lot
you
of
know?
people are
Like,
in the profession. There's a lot of hygienists that are working. They're 60 and 70, and they were working just because. Now they're like, I'm 70 years old. I'm not about to risk or jeopardize. So they're going to be moving out. So I don't think you have anything to worry about. Just stay positive, and what's meant for you is going to be. Absolutely. But you always want to have a backup. Like, there's a couple of you in here that do other things outside of dental hygiene. So, you know, create those streams of income. I know you're very talented. Everyone has something that they can do. Brand yourself. You know, if you're particularly good at treatment planning, were you a dental assistant before? You have that advantage. So I wouldn't worry too much about that part of it. So you just brand yourself, and now's the time to start working and start looking and making those relationships. Use social media to, you know, use that as a resource for connection and resources. Reach out to someone that you see. If you see a dentist on there complaining about blah, 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 just reach out. Hey, I saw your post. Like, you're absolutely right. Like, some people, they're like, oh, I remember Malcolm from that. And then you apply for a job in their city. And then they're like, yeah, I remember back in COVID when we were all panicking and thought this was going to last forever. I mean, just try to build relationships. I mean, that's the best. That's what I have. I mean, that's all I do.
I think it also deals with us understanding that there's opportunity as well. Like, because we're going to get to the point where we have a better idea of what COVID is. So I know while I was in class, they were pushing the idea of comprehensive dentistry or comprehensive dental hygiene. Now, how do we do that? Now, do we make sure that we do those things? We check for temperature. We do a better, more comprehensive medical history and involve ourselves with individuals like Joe or individuals like the doctor, as well as other maybe pulmonary or cardiologists. We need to have those connections so that we make ourselves more valuable, so we don't lose that actual ground. And then you have those ideas of, I know they do it, I don't know, you may know better than I do, Derek, that I know in New York they have the ability as dental hygienists to own their own practice, just like a nurse practitioner would. You have that idea where you can make yourself more valuable so that you don't come out on the end at a loss. So those are the things that I think will benefit us if we just aim towards those goals instead of retracting ourselves, as well as making the different connections that are out there.
I honestly think that, as far as like from what I've noticed is something has to happen for for things to change. I do feel like in dentistry, like Martel said, we are very relaxed, especially with PPE. What you do in school is nothing compared to what you really do in the practice. And I do think there's going to be a change in PPE personally. And I feel like our field will be hit a little bit, will be impacted for the first few 2 years as to figuring out what those changes are going to be. But I like to relate it to when hygienists didn't even wear masks or gloves to practice hygiene. They did it with bare hands until things started happening. They started realizing, well, maybe they should be wearing gloves. Maybe they should be wearing masks. I think that there's going to be a big change as to how we practice as far as PPE wise. Maybe face shields, N95 masks. Maybe we'll have some sort of creation that's catching aerosols to keep everything safe. I've seen a few things here on Facebook of people trying to create something to help with the aerosols. So I do feel that our practice is safe. I do feel like hygiene is here to stay. There's teeth, they need to be cleaned. That's always something that's gonna be needed. So as far as panicking with the job security and all this and that, I'm not too worried about it. I feel like hygiene is here to stay, and just as the field is growing and medical and dental are merging together and there's more importance now to our health, people actually will be more going to the dentist more. People that didn't want to get dental insurance before now are probably taking their health a lot more serious and thinking, maybe I should get dental insurance. Maybe I should go to the dentist every 6 months. I think there's a big spotlight on medical right now, and dental is part of medical. And I think it's our job to bring that message out. Like, hey, this is important. I'm curious to see how this is going to impact our PPE protocols in the practice. Not just in schools. I remember in school, we taped everything, even the ceiling. I'm wanting to know how this is going to change us in clinic. Will there be more regulation from OSHA? I've been in dentistry for 12, 13 years. I've never met OSHA. And I'm just like, where are they? You know, I've seen people cross-contaminate, do things like this. And sometimes by the dentist, it is ignored. And I can bring it up and preach about it all day, every day. But like Martel said, it's a very relaxed profession, because there just really hasn't been a lot of, how can I say it? Like, we haven't really been taking cross-contamination that serious from what I've seen. But I do feel like PPE will change for us, and I feel like our jobs, they're safe. We'll be back. It's just going to be with a lot of changes. I do feel that.
To piggyback on what you just said, Beto, and I totally agree with you. Like, for you guys that just graduate, I wouldn't panic just yet. I think we're going to be just fine. If anything, I think that is an opportunity for us hygienists to be the tone setters as far as being a teacher. Because let's be honest, people have been home for like a couple of weeks now. I think about my perio patient that I've missed, their perio maintenance by a few weeks or a few months now. When they come back, things are gonna be pretty bad, right? So, which is unfortunate, but I think we're gonna be okay. If anything, this is the time where we need to be more than ever the voice that leads the way on why what we do is so important. Because people that patients that we've spoken about, smoking and the association with perio maintenance, periodontal disease, maybe now they will understand, how just at risk they are, because people are now going to be looking at everything that they do, what they touch, what they eat, and just their general habit going through their lives. And so that is, for me, an opportunity for us hygienists to actually use that to even teach our patient and kind of like lead the way. I think we're going to be okay. I know this is pretty much it's a lot of uncertainty for a lot of us right now, all of us, honestly, but we're going to be okay one way or another with a lot of changes, which is honestly maybe needed, honestly. So I think we're gonna be fine.
I think you're going to be great because of the fact that I remember a time when I was an LPN, and they told us that they were going to get rid of LPNs. And even though they wanted to, they tried to, many ways or whatever, LPNs are still around. They're still doing patient care. They still in the front lines in many different facilities. So I would think hygienists would be the same. That we need you guys. We need you guys more than you think you need. We need you because of the fact that y'all are the hands-on of the dentist. More so.
Derek, did you have something you wanted to say? Derrick, Sven.
I was going to comment on what they had just mentioned initially, was that universal precautions, I imagine, are going to change a little bit here also. How many of you new graduates use the HIVAC when you're using the Cavitron?
It's something that we tried, but hands really.
It is difficult, but they're actually trying to make it mandatory in Washington State, where it's part of written in the law where you have to use it if you're using an ultrasonic. So you're no longer allowed to use the low vacuum, which would in turn help to eliminate some of the aerosols that are filling the air. Okay. So there might be some easy things we can do to limit the amount of exposure we have, like using a HIVAC, using the N95 masks.
That's what I was thinking.
There's probably just going to be some simple things we'll introduce, but outside of us actually having a vaccine that's available to the general public, we're going to just have to probably booster universal precautions here to make it safer for us.
I think having assisted hygiene is a great avenue to go through. I've worked in practices where I've had an assistant, and it made everything so much more easier for me as a hygienist to keep myself safe, keep the patient safe. And again, the HIVAC was used. I do use it when I do SRPs, but it's a lot more difficult. And I do notice that I strain my hand a little bit more using the HVAC. But I think assisted hygiene is one way. If you guys go back to practice in May, they're telling me if I'm ready to go back on the 25th of this month. But if you guys go into practice and nothing has really changed, I think one thing that you could request is assisted hygiene. I think that dentistry is going to be a little slow starting for everyone, including for the dentist, because people will be scared. It might be completely opposite. It might be jam-packed because people are wanting to come in. But one thing that you could request is assisted hygiene. And I think that will help control aerosols.
Assisted hygiene, and then of course there's things like the isolite, and there's some other new inventions I've been following that do utilize the HIVAC so that you can keep somewhat hands-free while you're doing hygiene. Those just might be things that are standardized.
I think they should. They should be.
When would y'all be comfortable going back into practice, considering?
I'm going back the day things are allowed in.
That's me too. I don't know, man. I guess even before it got shut down, it was to a point where I was like, look, I'm probably gonna catch this thing one way or another. So I just have to make sure I protect my family. So I was at peace with it because I'm like, we are so exposed to everything. There's no way I can fully, protect myself. So we are very exposed to all of it. So I'm just hoping one way or another we can, get this under control, because whenever we do go back, we're never gonna be, fully protected because of just the nature of what we do and the nature of this specific virus.
I guess I'm the oddball because I'm gonna wait at least 2 to 3 weeks to see, if everybody catches it. And so if you guys start posting brown girl, I got COVID, I'm like, no, I'm not gonna let you work. But if you guys like, 3 weeks later, 4 weeks later, I'm clear, I'm like, okay, maybe I'll apply for a job. But I'm just gonna wait a little bit just to see what happens.
Yeah, so COVID is one of those things that even me, I was being hella ignorant. I was like, I don't know anybody that has COVID. I was even telling Givi, like, do you know anyone? He's like, yeah, actually, my sister's a nurse and I do know some people that die. I was like, oh, really? Because I just drove to Georgia, a road trip. But a lot of people, if they're not affected immediately, like, it's like out of sight, out of mind. And I feel like that ignorance that a lot of people have has caused the panic, has caused like so many people in the hospital right now. You get a cough or a sore throat and you're like, oh, I got Rona. So it's just like, we've been panicking, and once the panic goes down, and of course the media is not helping, every time you turn on MSNBC and you see a press conference, you're like, wait a minute. They said not to be in groups of more than 10, but they 50 deep in the room, and what's going on? Like, are we supposed to be within 6 feet of people? Because they're right on top of each other in these press conferences. So it made people feel like, okay, it's not as bad as it is. And then people were being more lax. Now it's like you go into Home Depot, and I don't know why everybody's at Home Depot, but I was there, and they were like, they're over the intercom. It's saying like, make sure you wash your hands, keep it 6 feet. Like, they're telling you stuff that is like, why are y'all even open? Like, you're telling us wash your hands, keep a 6 foot distance, all of these things. Use the hand cart wipes or whatever, and it's just like, ooh. And then you see people in the grocery store with N95 masks, and you're like, I need that. Like, you don't need that. Picking up your Tostitos and your eggs and cheese.
I'm sorry. I'm one of those people with the N95 mask. I'm just like, I don't need that Rona. So.
You don't need it. So the PPE, like Beto was saying, they are going to, we're worried about going back and there being a shortage. And what about the first responders who need it? And we're dental professionals and we're non-essential. And maybe we don't need to be using the hoarding the PPE. But I just learned about, you have wet procedures and dry procedures, and you have the level 2 mask and then the N95 mask and then the level 3. So what they're saying is use those level 2 masks for dry procedures like exams or x-rays or ortho patient treatment. And then when you have to do scaling with the Cavitron or surgical extractions, crown preps, you're going to be wanting to use either the level 3 mask or the N95 mask with the face shield. But it's like, okay, so these are what the recommendations are, but then those are not, they're only recommendations. It's not mandated. So like Derek was saying, like, they're mandating that they use the HB on the high back. So it's just like, I don't know what we're going to do and if there's a shortage, but I don't know if you guys heard of the K95 masks. They're like from China, but they haven't been FDA approved yet, so they're not really selling them over here. But they're trying to get the K95 masks from China, which is the equivalent to the N95 in the United States, to distribute to the nurses since there's such a shortage. But I mean, I've been seeing some black market mask and stuff going on. I'm scared.
Me too. Somebody was literally on my Facebook this morning selling N95 masks for like one for $10, three for $30. I'm just like, are you serious?
You can get the K95 equivalent to the N95. What you're dealing with, first of all, is droplet. It's not really airborne. It's droplet. And that's why they tell you can stand 6 feet for 6 feet a distance. KN95, we get them from China anyway, so I don't even understand what the big argument is. But I think it's a money thing more than anything. Um, K95 is what I use. I use it every day, all day, because it's the easiest one I can get. Okay, if you can get the P100, that's all the difference from the P100 is actually all base. It actually they use it for aerosol sprays. People that work on cars and stuff like that, paint cars and stuff, they use the P100. Reason why it's all base. If you can find that, that would be just equivalent and actually it's better than N95. Um, the biggest thing is if you can find if you can get the KN95, go ahead and get it. Okay, they're running like $5.99 plus. Depends on where you get it from. So
It's crazy. So how long do you guys think? How long do you guys think that this Corona COVID-19 pandemic is going to be going on? Because you hear so many horror stories like July or next summer or next spring. Like, what are your thoughts on it, Joe?
I've seen that they were talking about they're going to be doing that Harvard study. They were talking about they're going to be doing social distancing valleys and peaks until 2021, 2022. So that's the question.
I believe it's going to be 18 months, at least 18 months, easily. Reason why, because like I said, people thinking that the weather's going to be an element. I don't know what region you live in or what have you. That's going to be an element problem right there. I don't think the weather's going to be any change because people are going to be people. Right now, we got a lot of social distance, but a lot of times, look at like Walmart. She said Lowe's in different locations where people are still bonding. Look at church functions. I mean, I understand you have a lot of distance with that, but just the same, you got a lot of bonding. Family reunions, funerals, and stuff like that. You know, I heard they had a military type of funeral, and they were actually giving the family the flag, and he took his mask off. You know, I'm like, okay, you know, if he had something at that time, then that person in that family may got sprayed or affected. You know, so I don't know.
So
I just go ahead.
So do you think this is like the new normal for us as Americans or us as a world, as the world for a little bit, like maybe 18 months, like you said?
Well, have you looked at, I mean, look at China, for example. China actually, every day, all day, wear masks. Every day, all day. Regardless of the situation, if you look at China, majority of the time, they're wearing masks because of some exposure to something, okay? I think that we're going to be more aware of the situation. I'm not going to say that we're going to wear it every day, all day, but a lot of professions where their practices were lenient, it's going to be more conscious, you know. So hopefully 18 months would be a short time.
In 18 months is about the amount of time they've been giving for a vaccine to become available. And until you have that available for populations that are more at risk, there probably will continue to be social distancing.
I mean, just to like, I do know someone that has had COVID, they tested positive for COVID, and his symptoms have not been bad at all. Like him, his sister's fiance, they've all been positive, and the sister recovered in 5 days. Fiance in 6 days. He's on his 7th day, and he's like, I'm fine. He's like, it's not as bad as the media is making it seem, which gave me a little bit more of like, okay, if dentistry was to open up, if I have the proper PPE, I'm fine going back. But just that kind of helped calm my nerves a little bit, because sometimes with the media and all this stuff and you're hearing all this, it does tend to scare you a bit. But that's what the media is for. Sometimes I feel like they have to exaggerate some stories to catch your attention. But when I'm hearing from people personally that are positive right now, that it's like, he's like, the breathing's a little different. He did say that. He's like, but as far as like in pain or that I can't take it, he's like, it's not what the media told me, what I expected based on what the media was saying.
Well, one of the things I always look at that, I understand what you're saying. Everybody's going to get attacked differently, and everybody, even on this form, may not be as healthy
Yeah.
and eat appropriately as you may. Okay. So my thing is, because there's a lot of underlying conditions, a lot of people that walking around here with high blood pressure, diabetic, numerous of diseases that they're not even aware of. Because of the fact that they're scared to get tested, their body equilibrium has changed to adjust to their different disease problems or conditions. So now they get this bug. Now it affects them different, or maybe they didn't think they had asthma, and now the respiratory issues are now more compromised. Okay, yes, everybody's metabolism is a little different. Okay, you may get it, and hopefully you don't. But if you get it, it might only be a 2-day, 3-day thing. As for my else, like I said, I know I met a guy that actually had 30 days. So
Yeah.
And that
Yeah,
goes
I
into
have
the
to agree with
responsibility of the civilization. You're responsible for the next person. You may not have an issue, but the person, your family member, your daughter, your niece,
That's
your
true.
nephew, your grandmother, whoever it may be,
Yeah.
they may be more susceptible to have a worse situation. So that goes into the responsibility of us not exposing ourselves and not gathering, I guess.
Yeah.
I have to agree with Joe as well, because like I said, my boyfriend works in the lab at the hospital here in Boston, and just today, and within a 15-minute time span, he told me about 3 people that died. 2 in which were his coworkers. His coworker's husband was one of them, and his coworker's grandfather was another, and then it was a patient that he had. And so it was just, for everybody, it may hit differently. For me, it hits home a little bit differently because it's so close. It's people that you're working with or people that you're interacting with every day or people that you may know. And for you, it may be, nobody's got it at all. And so I would have to just say, as professionals, we owe it to ourselves and to our patients to just continue practicing that social distancing, practicing being safe, washing our hands, doing all the appropriate things to make sure that we're taking care of ourselves so that we're not passing that disease along. Because like I said, everybody has a different story and everybody knows how, someone that it may affect differently. Like Joe said, you may have some conditions where it may affect you differently than it affects someone else. And so we just, as professionals, I feel like it's our professional responsibility to just make sure that we're protecting ourselves and make sure that we're protecting the people around us and our patients, And so.
Okay, guys. Do you guys have any advice or last-minute thoughts to any students, to any practitioners, to anybody out there in the medical field, maybe thinking about changing or just any concerns or resources?
Please tell me something.
Yeah.
Need a good job market, come to Seattle. We have a huge need for hygienists here, and the pay is outstanding.
There you go.
Okay.
I might think about that.
It's like $50-$60 an hour here.
Wow. I'm on my way.
I'll be in touch.
Yeah, one thing I'll say for people out there that are, thinking about switching careers, I think everybody, not just in dentistry, but just across the world, like we just need to take this time to just kind of slow down and just take our time and allow everybody to kind of realize what we're actually dealing with right now. Because, when this first started coming about, there's a lot of people that were like, oh, universal precautions, we can still do what we need to do. But I'm like, in my opinion, universal precautions are to protect against things that we've had time to research and realize how they affect us and everything like that. This corona is brand new. Like nobody really knows what we're dealing with. So I think that we not only owe it to ourselves, but to our patients to allow the time to pass for us to accurately research this and really realize what we're dealing with. And over time, things will kind of settle down. For me, I'm not thinking about getting out of dentistry. I love it. I know that, it's a part of the game to be exposed to Lord knows what day in and day out, but, I signed up for it. It's just like, back when I played football, I knew anytime I get on the field, I might get a concussion. That's all right with me. But I'm going to do everything that I can to protect myself, my staff, my family, my patients, everybody, because I took an oath to do no harm. I'm not in a rush to get back to working because taking care of everybody is more important to me than to getting back to business and to ramping up production and everything like that. So I'm all for taking the time to really analyze this. And when we do come back, I want us to come back the right way and not rush back just for the sake of making money. And then we end up with another spike or some kind of infection that we don't even know how to begin to attack. So, I mean, I'm a new grad myself, pretty much. It's a scary time, especially in a profession where all this time when I'm in school, everybody's like, oh, you know, once you graduate, you won't have to worry about job security. You know, dentistry's always going to be there. But I think the field of dentistry kind of got exposed with this COVID thing because we kind of felt untouchable as far as our job security. But then we get something that airborne that comes into the game, like everybody's all kind of shook up. But there will be changes. You know, I've heard rumblings of, you know, Henry Schein maybe producing like in-office COVID testing. That might be something that we start doing in the near future. But I mean, who knows? But all we can do in the meantime is just be safe and do everything that we can, that we know how to protect ourselves and our patients and our families. Because for me, you know, everybody's well-being comes before business and production and everything like that. And so I just think we all just need to take our time and just use this time to get back into this the right way. You know what I mean?
Anyone else?
Sir.
All right, guys. So yeah, thank you so much for joining and being a panelist for this discussion. This was amazing, and I really appreciate you guys, and I hope you guys are safe. If you need to, go ahead and put your contact information in the chat box, and if anybody watching wants to ask you a question or reach out to you, that'll be there for them. So again, thank you. All right, guys.
Yeah, thanks.
You guys.
All right.
Take care, y'all.
Take care.
Bye.